Good evening, a very warm welcome to this edition of Business at 9. I'm Vikram with the biggest buzzing business news of the day, but top of mind are health concerns that emerge during the very hot summer months, which have gotten even hotter now, and the forecast is this year is going to be a longer spell of a heat wave too. On the back of this, the Health Minister Mansukh Mandaviya has chaired a meeting to assess the preparedness that the country has to tackle extreme heat waves this summer. It comes after the Indian Meteorological Department has warned of above normal temperatures this summer season, about 10 to 20 days of heat waves instead of the more normal 4 to 8 days. In fact, Mr. Mandaviya has emphasized on the need for a central database to easily share data when it comes to deaths, the number of cases that are being reported. Let's find out what else is coming through in the advisory that has been put out. My colleague Samir Dikshit has been looking at all that is being said by the centre about tackling the heat wave that is upon us this summer. And earlier today from Delhi, he's filed this report.
After the weather forecast of a long heat spell or even the heat wave conditions in the country for the next 3 to 4 months, the central government on Wednesday reviewed the health preparedness for the heat-related illness. The important meeting was chaired by Union Health Minister Mansukh Mandaviya and was also attended by the Health Secretary, Niti Aayog member, and several other key officials. Larger emphasis was on to create a central database having inputs from the state, from the field level data or the inputs that will help to access the right picture, correct scene that is ongoing, getting the right data in terms of the death cases or whatever the situation is. So the emphasis was to create a central database with inputs from the state. The health minister mentioned that as of now, so far, whatever the steps the government takes in, but there is no accurate database which actually proves a deterrent in the fight against the heat-related illness. So a central database needs to be created. That was emphasized. And in addition to this, what we are also getting to know from officials that it was mentioned to the states that advisory was issued by the Union Health Secretary in the month of February to all the states that they have to follow the National Action Plan on heat-related illness, and that has to be strongly followed in the coming 3 to 4 months. In addition to all these development and the meeting, there is a advisory that has been issued by the Union Health Ministry that in detail mentions that what all steps need to be followed, what all precautions need to be followed, and what all not to be followed. For example, the public need to stay hydrated. They have to, avoid high protein meals, and of advice has been issued. So far, the government says that they are ready to tackle any situation.
The government said they are prepared to tackle any situation, but what is the possibility this time around, and how truly prepared are we, looking at how we've tackled heat waves in the past? And to discuss this, we've got Dr. Jayesh Lele joining us. He's the chairman of the IMA National Health Scheme. Dr. Lele, good to have you with us this evening. There is no doubt, Doctor, that the intensity of these heat waves has been getting more pronounced over the years, and now the intense period is also getting extended. How have you seen the nature of heat-related health effects and death cases even change as things get bad to us this time of the year?
Yeah, definitely we are looking out, and this is the effect of the global warming in general, and to the extent that India being near to the equator, the number of days, formerly we used to have 2 days, 3 days, 4 days, sometimes maximum 10 days. But this time, meteorological department said that 10 to 20 days the wave can occur, and which we are also working out that how to go about it, because our some of the areas, especially in the hilly areas also, as well as Nagpur area and some certain areas of India, Rajasthan for that matter, will have longer duration, stricter wave, and to tackle that, our medical association as well as we are going to release especially the previous experiences, how to go about it, what precautions to be taken by the persons traveling across, and fluid hydration, and what kind of a food, what kind of a clothes to be taken up. So all those things we are going to work out, and we are going to release it through our doctor friends across India, which will help us to the patients to tackle this heat wave in a better manner. We have had certain experiences of heat wave and heat stroke to that matter. Whenever the person is not in a position to have the heat wave for a longer duration, heat stroke occurs. And we have had patients, very few deaths have occurred, but the heat stroke causing damage to the renal areas, kidney areas,
Yes.
acidity and other things we have seen.
Indeed, and those cases have been growing as heatwave conditions have gotten more pronounced. Also joining us in this discussion is Dr. Khullar, who is a consultant for internal medicine at Sehgal Neo Hospital in New Delhi. Doctor, the government has put out an advisory today, and we are looking at this, Dr. Khullar, very closely. In your understanding, what measures need to be implemented to protect the most vulnerable from the scorching heat this season that we get after this fast shrinking spring season? Year after year, we've seen this. But when it comes to preparedness, where are we currently? Because there have been plans after plans, but in terms of execution of these plans, in reducing the number of fatalities, where do we stand?
Now, I've gone through the advisory. I think it is a very good step by the government that we are anticipating, we are preempting, and we are being proactive. So, education of the general population is the main thing, which is the main spade work which we need to do to avoid fatalities. In 2021, I think there were around 524 fatalities, and then it went down the previous year, which was 2022. And I have also gone through the advisory. I think it is a very well put advisory. It gives clear do's and don'ts for the general population. It gives do's and don'ts for the people at higher risk of developing heat-related illness. It defines what heat-related illnesses are and the worst form of heat-related illness, which is heat stroke. It defines when to reach out for medical help, what are the red flags that one needs to consider, and how to go about it and how to prevent it.
I mean,
I think
I understand, Dr. Khullar, that we are putting out an advisory, and that's an important piece. But when it comes to providing infrastructure to ensure that help is available when people are suffering extreme fallouts of the heat wave, are those in place? Is our infrastructure in place, especially in areas where medical services are not easily available? Dr. Khullar.
so. This is obviously that will not pertain to cities like Delhi, and in smaller cities, it is a possibility. But I think we are working on it. Yep.
Dr. Lele, I know that in Ahmedabad, after a heat wave tragedy in the summer of 2010, the city's municipality put out the country's first heat action plan, like they called it, in 2013. They focused on an early warning system. They increased the number of healthcare professionals. They introduced measures in workplaces, etc. But I want to understand from you, how effectively has it been implemented and what could make these heat action plans better so that they can be used as a model anywhere else in the country during these summer months?
Definitely, first thing is the awareness amongst the patients, guidance among the patient, and they had put up at all the places, especially the corners, the fluid intake, especially the water intake, electoral kind of a powders, ORS solutions, and at the same time kind of a juicy fruit juices and other thing, which ultimately have reduced the intensity, ultimately has reduced the, definitely as Dr. Khullar said, the death rate, and even the heat stroke was reduced to great extent in the particular city. So the plan need to be exercised in the all the areas wherever the temperature starts rising around 45 plus, the temperature rising, and then you have put to have those special task force into force, like we have experienced the disaster management, and the task force will definitely work on that, which will help us to tide the crisis before it reaches to that organ damage or certain things. So we should be in a position, and definitely it has worked in the city, so it should work in the other places also.
Are medical professionals easily available now? Where do we stand on their availability at this point in time, Dr. Lele?
Yeah, medical professionals will be definitely available, guidance will be available, and the fluid, basically fluid replacement will be definitely available at all the small hospitals, small nursing homes, and even for outpatient departments, they will have management, the distribution of the ORS packet, distribution of the water bottles, and distribution of the fluids will definitely reduce the risk of the going into the heat stroke, which will be the position to tackle. At the same time, lot of shelters we need to create where so that the patient can take rest in those particular areas, and at places water coolers and at least some AC wherever possible. We can use that in the areas where the temperature go extreme high, and we need to have this both the ways: reducing temperature, reducing the heat loss, the water loss. At the same time, keeping the proper dehydration will ensure this activity in a great strength.
Dr. Khullar, Dr. Lele, we certainly hope that these heatwave conditions, which are going to be longer than what we've experienced in the past, the intensity of it as well has been going up, and we certainly hope the infrastructure supports this kind of intensity. And that is something that we are counting on from the government. Thank you very much for joining us with your inputs and your perspective on this. Meanwhile,
if you like this video, then like, share and subscribe to ET Now.